Well, good morning, Annalise.
Hi, Jason. Good morning. And welcome to all of our wonderful guests who are filtering into our Zoom room today. We are already off to a better start than last time, aren't we?
We are. We're both here, and my links work today, so that's certainly a good start.
We are ready to go. I'm thrilled. It's great to see you. And I know that we've been really busy the last number of months, and it's going to be really exciting to share about all the great work that we've been doing with the folks that have tuned in today. So we'll get started in just a minute. People are still filtering into our Zoom room here. We've got a couple of dozen people who have already joined us, and we're expecting some more. So we'll get started in just a minute. We've just reached 10 o'clock.
Perfect.
All right. I see we've got quite a menagerie of folks here today too, Jason. We have staff members and donors. We have donors, individual donors. We have folks representing family foundations and institutional donors as well. I see a couple of volunteer names on the list, which is always nice. And even a couple of vendor representatives. So that's exciting, a nice eclectic group of folks.
No,
So
that's great.
good morning. My name is Annalise Smith, and I serve Avow as Senior Vice President of Philanthropy. I do have the pleasure of knowing most of you that have joined us today. We are thrilled that you've made time to be with us, to receive some information about what we've been up to in the last year, and to also take a glimpse at what we have planned for the future. Our special guest today, of course, is Jaysen Roa, President and CEO of the Avow companies. And in just a few minutes, I will turn things over to him. But first, I wanted to take care of a couple of housekeeping items. Jaysen has a wonderful presentation that he's prepared today, and we are going to reserve questions for the end of his remarks so that we don't distract him while he has his train of thought going. So if you do have a question, we encourage you to type them into the Zoom room at any time. You can make questions or enter your questions either using the chat or the Q&A features. So if you're new to Zoom and not familiar with the tools, if you hover your mouse towards the bottom of your screen, you'll see a toolbar, and there are icons that are named Q&A and chat. And you can click on either of those, and I will be monitoring both of those sections throughout Jaysen's presentation so that I can queue up the questions for him when he is through. And I don't need to tell you where the bathrooms or the emergency exits are, because hopefully you're familiar with those, and wherever you're zooming in from, maybe next time we'll be able to get together and do this in person. That is our sincere hope. But for today, we are happy to have Jaysen joining us from his home office. And with that, I will turn things over to Mr. Jaysen Roa, President and CEO of the Avow companies. Jaysen?
Thank you, Annalise. And again, thank you everyone for joining us this morning. Certainly appreciate you taking the time out just to learn a little bit about everything that Avow was able to accomplish, even with our challenges in 2020, as well as everything that we've already started on this year in 2021 and all the things to come during the rest of this year and the future. And so, again, as Annalise alluded to, certainly everything has been really focused here at Avow for most of the past year on COVID. But I promise you during my presentation, since we're all tired of hearing about COVID, after the first few slides, we'll focus just strictly on Avow and really what we are here for, which is our mission, focusing on patients and families in the community. And so if you bear with me just through some of the COVID slides, because that's the question that I get most frequently. Subsequent to that, we'll get into some of the more direct questions about patient care and kind of all the different things that we were able to do in 2020. And so just before we get started, Annalise, my good friend, can you see my screen? All right, I've got
Yes,
the sign that we can see the screen, which is certainly a good thing.
we can see the screen.
Okay, and so as I mentioned, during 2020, even though we had kind of this once in a lifetime event, as everybody has heard about, we still were able to kind of have an exceptional year for Avow in terms of our patient and family care that we were able to provide. And of course, like most of you, I had a skepticism at the beginning of the year in terms of how it was going to look when we look back retrospectively. And I'm happy to share with all of you that even with all the challenges that we faced outside of the pandemic, because we almost had a direct hit from a hurricane, we had another year where we had big natural wildfires that were burning in the eastern part of the county. Even with all of those challenges that were happening simultaneous almost with the pandemic, our team did an exceptional job here. And when I say that, really, the staff in the field that do hands on patient care just were phenomenal the entire year through the midst of the peaks and troughs of the actual outbreaks here in the county. I think at one point we got above a 20% positivity rate with COVID. And never once did we have staffs refusing to go out and see patients. Never once did we have staff just stating that they didn't want to do their job. And so I can't be more proud of everything that the team did during the entire year. And of course, even our management and leadership team, obviously you all know Annalise and the great work that she and her team do. But in addition to that, our response to the pandemic would not have been possible without the entire executive team and the leadership team and the management team here. They all were amazing. And I can't say enough about them. And certainly we would not have had the success in providing patient care through the pandemic if it was not for all of them. So having said that, as you can see on the screen, this is a picture of our campus that was taken actually right at the start of the pandemic before it really kicked into full gear. So you can see there's a lot of cars in the parking lot there. Obviously, for most of the past year, as a result of COVID-19, we certainly were working remotely. I'm still here in what I refer to as Amy's home office, my significant other, because this was her office before the pandemic started. And I've kind of moved in, so to speak, when I'm not at our regular offices at Avow. But as I said, we're not going to focus too much on COVID-19, but I certainly want to share with you some of the important information in terms of our response and just some few statistics on it. And then we'll move forward focusing, I think, on what you're all interested in is certainly our patient care for the year. But obviously, as I said, COVID-19 was not something that any of us expected to happen. And the good thing for you as donors and as volunteers, staff, or even some of our vendor partners, we work always throughout the year on different emergency response plans, including pandemic response plans. And that's part of the reason why we were able to successfully respond to COVID-19 the way that we did and continue to do now through 2021. And these are just a few of the things that we focused on and continue to focus on now, even as the pandemic is hopefully winding down. But our response included trying to find and secure personal protective equipment. I think last year at our town hall, I mentioned the fact that we had a little bit of a head start on what many other healthcare organizations in the United States were doing in terms of their COVID-19 response and trying to acquire PPE. And it was about 2 weeks, but that 2 week lead time with us actually activating our plan. And we actually had our first informal meeting about this mysterious virus that was coming out of the Asia Pacific area in January. And then in February, we had our first official meeting. And then of course, in March is when we activated our pandemic response plan. But activating it when we did allowed us to, as I said, get a jump start on acquiring personal protective equipment. And that was kind of a key in the early days of the pandemic when, of course, as we heard on a daily and weekly basis, there was just this shortage throughout the US. And that was especially important for our staff, to keep our staff safe and ultimately to keep our patients and their families safe as well. And it got to the point with the shortages that when our staff were showing up to some of our long-term care facilities, the facilities did not want them coming in the Avow fully garbed PPE, including goggles, N95 masks, gowns, gloves, because our staff had ample supplies of all of that. And in many cases, their staff did not. So it was kind of creating, at least in the minds of some facilities, this inequity. But we told them certainly our staff would not be put at risk, and slowly those kind of strange comments subsided, and we were able to do our jobs throughout the community. And even in patients' homes, many patients and their families shared with us that they were relieved when our nurses, social workers, nurse practitioners, physicians were able to show up and actually have the necessary PPE, not only to protect them, but also to protect the patients and their families. And so that was one of the things that was kind of a key to our response early on. And we dedicated one person on our management team, and their only job full time was finding, securing, and purchasing PPE, which again was a kind of a monumental task. And then, of course, we implemented symptom screening was another response, which was vitally important. And so this was something that our IT team working with employee health did early on, where every morning we all get a symptom screen that's automatically generated. We respond to it that answers all the different questions that are required either by the CDC or the State Department of Health. And that gives us an idea in real time if any of our staff are feeling sick before their shift starts so that they can stay from home if necessary. In addition to that, testing was a huge, huge issue, I think, early on in the pandemic. And Avow has spent a considerable amount. In some subsequent slides, you'll see kind of the amounts we spent on some of these items, but testing and our testing strategy was something we felt was key, again, to keeping our patients and families safe and ultimately our employees safe. And what I will say is, and you've all probably heard it, many people respond differently when they're afflicted with COVID-19, and specifically perhaps the strain, or in many cases, who they were exposed to, and just how much of the virus was contained within that individual. So in many cases, when our staff has tested positive throughout the year at one of our routine testing sites, these were individuals that showed no signs or symptoms of any of the COVID-19 symptoms. And so having the testing in place was important because, of course, after they tested positive, sometimes days or even a week later is when they would become symptomatic, but we were able to keep them out of the field, interacting with patients and families, or even interacting with other staff as soon as we knew they were positive. So that was, again, one of the keys to our success and during the pandemic in terms of our overall strategy. And then, of course, we've had enhanced cleaning at the Francis Georgeson Hospice House, which has been the only building that's been in constant service to our patients during the entire pandemic. Most of the campus throughout the pandemic has been shut down and not open to outside visitors. We have not ever shut down the hospice house. And so with that, we did hire an additional housekeeper whose only job during the pandemic is to do nothing but go around and sanitize every single public area, every place that anybody could come in contact potentially with virus. And that's what that person does full time all day. And that's in addition to just our regular cleaning protocols that we have in place. As I said, staffing at the different peak times during COVID-19 has been somewhat of an issue just when we've had at any point in time, perhaps more than a few staff members that were quarantined, either because they think they had contact with somebody who was COVID-19 positive, or because they in fact did test positive themselves for COVID-19. And as I mentioned, the campus restrictions that we've had include closing the majority of the public areas, including the Aspiri Center, Lyons Center, Smith Administration Center, as well as requiring anybody who comes on site to keep a mask on during their entire time on campus, especially if they're not one of our staff and they're in the buildings doing service on our buildings, or for any of the visitors back at the hospice house. And that's another key point as well. During the entire pandemic, we never once stopped visitation for families back to our hospice house. We, of course, had to modify how many family members would be able to come back and see patients there, but we never did stop visitation as a whole, which was happening in a lot of healthcare facilities around the country, including Florida, like hospitals or nursing homes or assisted living facilities. And so this is just a brief snapshot of some expenses that I often get asked about. And so as we go around this slide, you can see that just for our COVID-19 testing expense through the end of 2020, this does not even include our cost for 2021, we spent over $500,000 in testing our staff for the year. And again, that is a huge number, but not only did we do it because it was the best practice, but in some cases it was mandated by the federal government that we had to do testing for our staff that was going into nursing homes up to twice a week based on the percent positivity rate in Collier County. And so again, those costs have continued on into 2021, but we think that they will decrease certainly as we come to the middle of the year here. And by the second half of the year, we'll see a significant drop in those expenses. Our PPE cost, again, through the end of 2020 was just around $367,000. And that includes, you can see the picture there of an N95, gowns, gloves, masks, and all the other items that any of our staff would need to protect themselves. And in many cases, we would also give masks to our patients and their families just to reduce that contact and spread potentially of any virus. And of course, we're joining you today through a Zoom webinar. And so we had a lot of other different costs to implement immediate work from home for the majority of our staff. And so our cost for all the software and hardware associated to that was around $127,000. And then finally, there were a lot of other different supplies and materials. For some of you who have visited the campus during the majority of our time when it's been mostly shuttered, although now we've restarted some volunteer activity. We do have touchless temperature screening devices at every entrance to the building, as well as hand sanitizer at every single building entrance and throughout every single building. And so these are just a couple of samples of some of the additional costs that we incurred just in our response to COVID-19. And above and beyond that, we spent over $600,000 on other COVID expenses. And of course, some of you may be asking, what are other COVID expenses? These are primarily staff expenses, whether it was bringing in contract staff to fill gaps as related to COVID, or all the other benefits we provided to our staff during COVID. Because we're a healthcare organization, we were not necessarily required to comply with a lot of the CARES Act mandates that affected non-healthcare organizations, specifically for paying for sick leave for any staff that were afflicted by COVID-19 for up to 2 weeks. That was actually voluntary, but we at Avow told our staff we were going to comply with that, even though we did not have to. And so those were some of our expenses. In addition to that, we paid hazard pay for any of our staff that were in direct contact with COVID-19 patients or patients under investigation for COVID, as well as all the other things that we did throughout the year for the staff, just again, to make sure that they were compensated and they felt secure in their positions. And again, I made a commitment to them early on during this pandemic that we, unlike other organizations, we're not going to furlough, lay off, or change any benefits for our staff as a result of this. And we've kept that promise not only through the end of 2020, but I've reaffirmed it with our staff for 2021 as well. One of the big impacts, of course, to COVID, we did have lockdowns here in Florida. Many of you are from here, but I know we do have some guests from other parts of the country. And so our Treasures thrift stores were actually closed. And of course, because we rely heavily on our wonderful volunteers who work in these thrift stores 6 days a week, and during the pandemic, not only the shutdown and subsequent to that, it just was not safe to have our 65-plus-year-old volunteers coming back in and being exposed to the public. So as a result of that, and I think as a result of the general public as well, not necessarily wanting to resume normal activities between shutdowns and just overall decreased sales from the year, you can see on this slide that we budgeted for over $1 million of sales and Treasures for the year and came in at just under 50% of that. And so, our loss compared to budget was about $573,000, and certainly a big deal. This year, again, as I mentioned, we're slowly getting back on track. We're slowly starting to resume volunteer activities. And I think with all the pandemic fatigue that everybody has, people are really starting to resume some sense of normalcy, and we are seeing an uptick in our sales at the Treasures locations. And this is the other question that I get frequently, not only from our staff, but also from our volunteers and donors and just people that I meet in the community, primarily via Zoom, is how many patients or has Avow taken care of any COVID-19 patients during the pandemic? And we have. And so through the end of the year, through the end of 2020, we took care of a total of 121 COVID-19 patients. And again, many of these were taken care of in cooperation with our partners in the community, whether they were patients at both hospitals, as well as at different facilities around Collier County. And that's a big number. And I wish I could say that these patients got better, but again, the majority of them did not, but we were able to provide care, comfort, and support to them, as well as provide that same care to their families, supporting them through not only what was a horrible pandemic, but also the loss of a loved one. And, as I said earlier, the key was making sure that our staff felt safe and secure during this and had ample supplies of PPE during the entire time they were caring for these patients. And so, just a couple of highlights here, and I'm going to go through and share with you really by the different areas that Avow encompasses, and share with you a little bit about what we were able to accomplish, even in spite of this global pandemic. And so, for hospice specifically, for the first time in our history, we admitted over 2,000 patients in 1 year, and that's really kind of a monumental milestone. And again, as you're all probably aware, Avow is one of the larger hospices in the United States. Out of the remaining 1,000 not-for-profit hospice programs that operate, we're in the top 50 in terms of our size. And that enables us to do a lot of things that perhaps in other states, hospice-centric organizations cannot do. So certainly this was monumental, as well as the fact that for the first time in our history, we achieved a milestone of being able to take care of over 400 patients in one day. And we did this all during the pandemic, which is why, if you'll reflect back on my earlier comments about our amazing team here at Avow and the staff, all the way up from the executive team down to the field staff that are caring for these patients each and every day. They were doing all this in the midst of a pandemic. And I can't stress that enough, just how amazed I've been throughout the year at the wonderful job they've done. And when we talk about these numbers, it's not for the fact that they're just a number or because we're trying to achieve more admissions or a higher average daily census. Each one of these numbers represents patients and their families that we're able to care for every single day. And that's what we try and refocus our staff on all the time, is this is actually a real number of representation of how we're caring for the community at a point in time. And so in addition to that, of course, in the midst of all of this, we, as many other healthcare organizations were able to do, implemented telehealth. And of course, that was with some assistance from the federal government, who finally got pushed over the finish line to allow kind of this widespread implementation of telehealth, which of course has been a challenge for many healthcare organizations or trade industries to get across. We in the hospice and palliative care industry have been trying to do this for a number of years. So that we can be available to our families through another means or mechanism, and that finally did happen this year with the kind of the relaxed standards, so to speak, of some visits that we were able to do, which prior to the pandemic were required always to be in person, but now we were able to do as well through telehealth. And then we had a number of projects we were working on through 2020. And of course, one of the big projects was the renovation of all 16 of the patient rooms at the Francis Georgeson Hospice House. And of course, as a result of the pandemic, that did stop for a short time. And so we have resumed those renovations. I'm happy to report that 4 of the rooms have had the majority of the renovations complete. We now have the second set of 4 that we're working on and should be wrapped up within the next 2 weeks. And then we're doing them 4 at a time. And so by the summer, all 16 of the rooms that are all private facing the Lake Glenna will certainly be renovated. We'll have all new finishings throughout the room, brand new furniture. Basically, we gutted the rooms down to the studs, redid the drywall. All the restrooms and showers have been completely redone. And again, the goal, as you can see in the picture there of our architect's representation, is really going to be kind of a light, airy beachside feel. And so we're excited about that. And, a lot of people ask about the renderings, if the room will actually look like the rendering, and the answer is yes. And I can tell you, just with this picture alone, you can see that it has a faux shiplap on the walls. That's probably been the biggest challenge of this project, is finding the right product to go on the walls to make it look like shiplap that you would see perhaps in a cottage in the Northeast on the water. But we are moving forward with that, and we have a couple of final contenders for a product that will not only give it a home-like feeling, but also be durable enough to withstand all the different wear and tear that happens in a facility like the hospice house. And so certainly more to come on that. And hopefully the next time I meet with all of you, I'll be able to show you the finished versions of the rooms. And I can tell you, we're certainly excited about that, and have had high marks so far from patients and families who've been through at least the 4 partially renovated rooms that are complete. And in addition to what we do just in hospice, and certainly what we're known for in Collier County, oftentimes Avow is synonymous with hospice only. We do so much more than hospice, and obviously all of you are aware of that. But it's a consistent and constant challenge for Avow to share with the community everything else that we do for the community, other than end of life care or other than palliative care, which is even a challenge for us to get them to understand that in some cases. And so our Avow Kids program continues to prosper. And just as a reminder, the Avow Kids program is not for kids that are on hospice. This is for children who have experienced some type of loss. Certainly, what it's been known for many years is children who've had a death in their family. But more recently, we've expanded it to other sorts of loss, including children who've went through a traumatic divorce with their parents, children who've had a parent that's been deported, a parent that's incarcerated. And so the Avow Kids team does an exceptional job of really counseling children at different ages as they're developing, no matter what their loss has been in their life. And they continue to provide this service even during the pandemic. And so you can see some of the statistics there where we helped over 300 unique children during the year, and continue to have different support group activities that were online, as well as doing different camps and events that were a combination of online. And again, as the pandemic went on, we did some that were actually either outside or socially distanced if we were able to do. And we did one camp during kind of one of the troughs of the pandemic, when our percent positivity rate was real low and all the cases were on a significant decline. And in addition to that, what we've done over the past few years with the Avow Kids program, much like we do in hospice, is we've partnered with a lot of other not-for-profit community agencies. And obviously in the hospice program, our main partners are both hospital systems here in Collier County, as well as the Lee Health System in Fort Myers, and all the different long-term care facilities here. But with the Avow Kids program, having really good partnerships is important. And so you can see a list of local Collier County not-for-profits that we've worked with throughout 2020 with the kids program, providing a whole number of different activities or programs in different formats. And so you'll see this in the future as well going forward, where we continue to partner with great organizations like this for our kids program moving forward. And that's kind of a key to success, is looking at all the resources in the community in a holistic way, and making certain that the families that we care for, the kids that we care for, are connected with every other resource. What I often say to our staff during orientation to all the new hires, or even try and remind the staff at our all staff meetings, as long as it's ethical or legal, we will do it. And if it's something that's completely outside of our scope of practice here for any of our programs, we want to make sure that our families are getting the service they need through one of our community agency partners. And so that's really the goal with expanding these partnerships in the community. That way, the kids that are on our Avow Kids program also have access and resources to other really great not-for-profits, and the services that they provide that probably are very unique as well, and outside of the scope of what our team can do. And then again, this is just a brief sampling of some of the different groups for Avow Kids that we did throughout the year. Obviously, for many of the 2020 seniors graduating from high school, this was a very frustrating time because they got robbed of their last year of school. And in many cases, graduations across the country were canceled. And so as a result of that, we provided support for some of the kids that were affected by that, or having a hard time dealing with not really having that closure before they transition on to college or whatever their future may hold for them. We also did an Avowoween, where it was kind of the equivalent of a trunk or treat that you might have seen around the country, where again, it was socially distanced and kids were able to come through and see all of the trunks and vehicles of our different staff members decorated. And so this was a fun activity. And I want to say we had over 200 kids who actually came through for that event, which was hosted in the Avow parking lot. We did, as I mentioned, have our Camp Mending Heart for teens. This year we only could accommodate 17 because the goal was to have social distancing during the entire event. And so that's why we had to cap the amount, but we were still happy that we were able to provide some sort of camp. And then we had a couple of other events like the ice cream drive-through at Aunt Janet's house, and that was in honor of the Children's Grief Awareness Day. And then we also did a holiday cookie making with the Salvation Army as well. So different events that we did, again, just trying to be still very conscious about what was going on with the pandemic, but not in any way completely stop activities whatsoever. And then our adult bereavement continued as well. And again, as I mentioned early on, there were a lot of areas where we prospered even in the face of the pandemic. And the Center for Grief and Loss was able to transition the majority of our different initiatives that we have for groups and even individual sessions online. And so you can see the comparison there between 2019 and 2020, the increase in overall clients served as the adult bereavement team keeps count, and going up almost by 1,000 different client visits that happen is absolutely amazing. Again, in the face of the pandemic, and I just can't say enough about the team for being able to make that happen as the pandemic continued. And then, of course, our veterans activities continued on. And after this slide, we have an exciting announcement to make for those of you who may have not seen it yet. But we continued all of our different veterans programs, although, again, a lot of these were modified during the year. And you can see there the statistic. We had about 542 veterans admitted to hospice in 2020, and we were still able to provide salute ceremonies to 499 of those, which is excellent. And many of our veterans who come into us, we really have for a short length of time, especially if they come back to the hospice house. And so sometimes it's difficult to coordinate with the family and with the veteran and do those salute ceremonies in an appropriate way. But we're excited about that. And you can actually see one of our veterans who's been pinned. He's a World War II veteran. You can see that one of our staff, I believe that's Linda Mitchell, is putting the pin on him. And then also there, he has his Avow veteran certificate. And they also do get a blanket that has an embroidered logo for the branch of service they served in. And so that program will continue on, and we've actually expanded the veterans program. And as a result of that and the efforts of Annalise and Jack Fulmer, one of our former board members who is still involved actively with our veterans program, and the entire veterans committee, we were able to achieve We Honor Veterans Level 5 status. And so as you can see the little statistic at the bottom there, out of almost 4,000 organizations that are participating in this program, there's only about just under 4% that actually achieve this status. It is a big task. It requires a lot of continuing education, activities throughout the year, and it's not something a lot of organizations want to do because of the commitment of time that it has, not only for the committee running it, but also for staff. But we felt it was important to, again, gain this additional star. We were at We Honor Veterans Level 4, which had been the highest tier for some time until more recently, NHPCO and the Department of Veterans Affairs expanded it to this 5-star level. And so certainly thank you to Annalise and the entire committee for making this possible. And this just exemplifies our commitment to veterans that serve in any of our forces, as well as our volunteers and staff that served, and of course, our patients. And another final challenge we had, which was getting across the line, was our Sage Care certification as a platinum member of Sage. And this organization is specific to seniors who are in the LGBT community and how to care for them. Obviously, we try and focus many different aspects of different populations so that they can get access to hospice sooner than later, palliative care sooner than later, or any of the programs we have at Avow. We are certified through the National Institute of Jewish Hospice. We do have the Veterans Program. We have all these different programs that we do that are unique. And this was another opportunity for us to reach out to a specific community to make sure they get hospice and all of the different services at Avow sooner than later. So again, this required additional education for our staff, different training, but we're proud of this and achieving the platinum status. So again, we can meet these clients where they're at, or these patients where they're at during the time with us, no matter what service we're providing, whether it's hospice, palliative care, or bereavement services. And then, of course, our Avow palliative care program continued on even during the pandemic. And although this program is a little bit different than the hospice, where it's more set up like a interdisciplinary physician practice, we still were able to continue on providing excellent palliative care to patients and the support that their family needs with whatever disease process they may be going through. And so, although initially in the pandemic, we did transition very quickly to telehealth visits, again, as the pandemic continued, we were doing in-person visits and continue to do a hybrid of telehealth in-person visits. And again, as the overall percent positives and case counts in Collier County dropped, we were able to see patients back at the Lion Center Palliative Care. And of course, during the year, we continued to work on our CHAP accreditation. And this is a gold seal, similar to the way we're accredited in hospice by the Joint Commission, just so that not only our patients, but in the future where payers are starting to take over, kind of dictating to a certain degree healthcare, this will be a seal that shows that the Avow Palliative Care Program is really kind of at the pinnacle of quality. And not only are we accredited, but we meet all these different standards above and beyond whatever the accreditation is or the licensure that we're required to have by the state of Florida. And so that is very exciting. And we hope to have that finished this year before year end. In addition to the fact that Rebecca Gatton, who's our Chief Clinical Officer, is overseeing all of the operations now in our palliative care program and has instituted a lot of changes and expansions in terms of how the palliative care team is operating, which is very exciting. And so we're looking forward to continued growth in palliative care in the future. And certainly at this point, we are currently working at attaining some different contracts with national insurance companies to provide palliative care to their patients that live within our service area here in Collier and Lee counties for the palliative care program. And of course, our foundation team, when we're talking about caring for our patients in the community, a lot of it is made possible through the ongoing hard work and dedication of the foundation team. And you know, oftentimes when I'm speaking with my peers or colleagues, not only from around Florida, but even around the country, they're shocked by just the level of programs that Avow has so far outside of the realm of just what basic hospice care would be, or even outside of what many organizations are doing for palliative care. And that wouldn't be possible without our foundation team. And of course, all of you that are participating today and all of our other donors who support all of the different programs that we have. And so I'm excited to say that 2020 was the best year in Avow's fundraising history, based on all of your support, as well as the great work of our foundation team, keeping our donors engaged during the pandemic. In addition to that, we established a $1 million Ivan Bowen Family Foundation Palliative Care Endowment. I cannot express to all of you how this is huge for us and huge for all the care we're going to be able to provide for patients that are not on hospice, but just need palliative care services, both now and in perpetuity. And so this was very exciting. And this is something that we had certainly strived for many years. And I can't say thank you enough to the Ivan Bowen Family Foundation. In addition to that, we were able to also establish a $1 million Avow Hospice Endowment. And so I think you will all see over the course of the next few years, we are going to be focusing on planned giving. We are going to focus on endowments, because these not only ensure that we're taking care of patients today, but this also ensures that the type of care that we provide here at Avow under our umbrella of services will exist into the future, regardless of what perhaps the government may do with our payment structures in hospice or palliative care. And so it's vitally important that, again, we continue to endow all of the programs that make Avow different. And I'm excited to be able to announce these two. And there's another one coming up shortly as well. And we also cared for our staff throughout the year. As I said, above and beyond just providing them with PPE, we made a commitment that we were not going to change any of their benefits during the year, as well as not going to furlough or lay off any staff. And I repeat that only because that was a real fear for many of our staff members. And they did have spouses, significant others, or even adult children who unfortunately lost their jobs in the pandemic and were laid off almost immediately. And so we know that they were affected, even not directly by Avow, indirectly by their family members. And that's something we kept in mind and tried to support them in any way we could throughout the year. And so, of course, as it may seem counterintuitive, we provided all the support, and we wanted to find out not only how they felt about working in Avow in general, but how they felt about working for Avow during this pandemic. And we went through a very kind of comprehensive survey for all the staff through the Great Places for Work Institute. And I can tell you, I was cautiously optimistic we would do okay, but certainly you never know how people are going to respond to these type of surveys, especially in the midst of a pandemic. And so I can't be more excited, of course, to share that the overwhelming amount of staff were extremely satisfied with their job. You can see here the statistic was 91% of respondents were highly positive about working here at Avow. And I think that speaks volumes that we did this survey in the midst of the pandemic. And that's really how the staff felt, even in the midst of all the stress and the burden of dealing with the pandemic as frontline healthcare workers. This was how they responded. And so certainly you can see the statistic there that an average company is based at 59%. We're certainly not an average company, and I don't really pay too much attention to that. But what I will share, there's another great organization here in Collier County called Arthrex. You know, they're a multi-billion-dollar company who works on arthroscopy and excision tools. And a lot of people kind of are excited when they get to work at Arthrex. And anytime there's an opening, I know they have a lot of applicants. And so Arthrex, which is an exceptional company here in our community, their overall positivity rate in comparison to our 91% comes in right at around 86% the last time that I looked. So just to give kind of a benchmark for those of you that are in Collier County and familiar with Arthrex, that's how we stand against another really great employer in Collier County. So again, this was excellent. Colleen Billings, who's our Director of Human Resources, put this together and got it out there very quickly to the staff, and we were able to get these responses. And as a result, not only of the positive feedback that we received from staff, but also any sort of comments where they didn't necessarily understand something, or even areas where we didn't get the highest score. We're now working on action plans throughout the organization so that we can address those issues. Either number one, because perhaps they were something that Avow didn't realize we could help staff out with, or number two, if we were providing something but staff didn't realize it, whether it was a benefit or something else having to do with their job. And so we're continuing to work on that, but certainly exciting news that we're able to use this logo and be considered a great place to work. And so, you know, that's kind of a really quick summary. I know I went very quick through those slides, but I know Annalise is waiting to give me the hook if I'm running over on time. But before we open it up to questions, as I did go through those quickly, just wanted to share with you some of our successes so far this year, as well as our plans for the future beyond perhaps what we're doing right now. And so the first thing, which is very exciting, is Avow is implementing an artificial intelligence application within the next, hopefully, 60 to 90 days. And really the main function of this program will be to go into our electronic medical record and extract all the data on every single patient that we have on service and be able to tell us with a very high degree of certainty how that patient is doing within their disease trajectory and their disease process. And so this is a technology that we initially looked at 2 years ago, and it was fairly new at that point in time. And we really didn't want to be a beta tester, as well as the fact that it is fairly expensive. But now there have been enough different programs throughout the country that we're using the specific application that we are implementing, where looking at their product now, they made significant upgrades from when Avow first looked at it a few years back. And so we are in the process right now of implementing this program. And again, it uses machine learning that it's gathered not only from the patients here at Avow, but also patients at other hospice programs throughout the country to really determine a patient's prognosis. And that is something that will be invaluable to us. And of course, we have excellent clinicians here, excellent staff who are trained over and over on how to prognosticate. But as we often say, it's impossible to have that hospice or palliative care crystal ball where we can definitively tell a patient or family how much time they have or what their disease progression will look like. With this technology, we will actually be able to do that again with a certain degree of accuracy that is not possible without this type of technology. So extremely excited about that. And I think it will vastly improve us getting the right resources to the right patients at the right time. Not that we're not doing it now, but this would bolster the existing efforts of our really expertly trained staff going forward. So certainly an exciting development, and I will keep all of you posted, and hopefully as we meet later on in the year in person or perhaps next year, we'll be able to share some statistics in terms of how successful this has been. And again, this also kind of goes hand in hand with our simulation training lab. Although we do consistent and constant training for our staff and our volunteers, we wanted to take that staff to another level. And one of the ways we're doing this is through the simulation lab, where in addition to having a high fidelity medical mannequin, which again, as you can see in the slide here, will be able to mimic actual different things that would be going on with a live patient, whether it could be blood pressure, not feeling well, vomiting, or some other type of medical emergency that's going on, like some of the ones that are listed here. The staff will have to respond to this in real time while somebody is operating the mannequin from another room. And so this is an exciting way that we think we'll be able to train staff in a real life scenario without having to train them on a real patient. And we'll be able to do this in a controlled environment. So not only will they be able to receive feedback from their peers who will be watching through a double-sided mirror, but they'll also be able to see themselves on video and reflect on how they interacted with this patient and or a family that may be in a room. And the training goes beyond just clinicians. We also plan on having this training for our psychosocial staff, including social workers and chaplains, so that when they're interacting in this safe environment with potential patients or families or bereaved, we'll be able to show them what that interaction looks like and provide positive feedback, as well as critique anything that perhaps we can change to overall improve the type of care that we're providing. And again, this goes over just some of the other items that I just mentioned in terms of the overall goal of the simulation lab is for one purpose and one purpose only, and that is to provide just the best possible care to our patients when any of our staff are out there face-to-face with them in the field. And of course, I mentioned earlier, the hospice house has been undergoing renovations for almost the past 4 years, constantly, whether it's replacing all the flooring in the building, doing updated paint. You know, in years past, during these updates, I shared with you our new nurse call system, as well as our sensors that all the staff wear so they can see where any of their peers or colleagues are in the building. That's continuing on. And my goal with the hospice house is to make sure that every family or patient who goes through there has a 5-star experience. And, you know, we're not trying to make that rhetoric. We're trying to make that a reality, not only with the care that we provide, which has always been exemplary, but also with the overall look and feel of the building when patients and families are there. And so to that extent, one of the things that we've been asked by many patients for many years is if there was some communal place where they could have a meal together. And certainly many families are coming together at the hospice house during a tumultuous time, and having that would be comfort to them. And so certainly in my family, food has always been the way to fix any problem. And we think that this will be a great resource for those families. Right now, we've just finalized the final floor plan based on all the different regulations of it. And so we hope to get this project kicked off again within the next 30 or 60 days, select a contractor and move forward. And these renovations will be complete before the end of 2021 for the new family cafe. So we're excited about this. And again, I hope the next time that we meet, if not earlier, then next spring, I'll be able to share some actual pictures of the finished product for those of you who can't see it in person yourself when we do open up the hospice house to visitors again. And a couple of other changes at the hospice house as well. And you know, the point I want to make is we're not just making changes to make changes. We make changes that are going to positively affect patients and families. And many of these are either requested by patients and families, or told to us by donor-directed contributions. And so these are a couple that, based on donors saying this is their wish for something they'd like to see based on their experiences there. And so one of them is a covered pavilion that's going to go over the existing garden that's in front of the main entrance of the Francis Georgeson Hospice House. And we plan to have that completed simultaneous with the kitchen cafe renovation project. And so that will be done before the end of the year. And also another interesting feature, which staff have been asking me to do for years, would be to put a fountain on Lake Glenna. And you know, again, we don't just do things to do them. We don't expend our resources, but we did have a donor who directed the fact that he wanted to see a fountain so that all the families back at the hospice house would be able to see fountains and have some sort of peace and tranquility by just watching the fountains from the hospice house. And so we're excited about that. And the next slide coming up will kind of show you how they'll be laid out so that they are looking nice on Lake Glenna overall. And finally, as I mentioned earlier, another endowment that we're very excited about is the Francis Georgeson Hospice Endowment. This was an endowment granted to us based on the care that we've provided to multiple patients. And specifically, this is to make sure that the hospice house, the way it looks today, and just how so many families are impressed with the way that it looks in the field, will look like that in perpetuity. And so with this endowment, it will cover renovations on an annual basis, upkeep of the building on an annual basis, or any general maintenance that has to happen on an annual basis. And here's kind of an overview of the top of the campus. If you can see here, this is the hospice house here, if you can see my arrow. And these are the fountains that we're putting on the lake. So the middle fountain here will actually be 150 feet across. It's a 3-tiered fountain. It shoots 85 feet in the air. And then we have 2 smaller fountains that kind of are bookending it, which will be about 50 feet across. And again, they shoot about 50 feet in the air. And they're going to be triple-tiered fountains. And so this is something that, again, the staff have asked for years. But now we've had a donor who said, I think this is something that patients would appreciate back at the hospice house and their families. And so thanks to the generous donation, we are going to make this a reality. And this will actually happen a lot sooner than before the end of the year. We expect these fountains to be in and operational within the next 60 days. So very excited about that, and very excited again that the patients and families at the hospice house will benefit from seeing them. And a couple of other slides, and I'm going to go fairly quickly because I know Annalise will come on in any minute and tell me I have got to wrap it up. But Avow is a member of the National Partnership for Healthcare and Hospice Innovation. This is a group of around 76 not-for-profit hospice-centric organizations around the United States that have banded together to provide care above and beyond what is really kind of commonplace in the hospice or palliative care industry. And so one of our initiatives as a member of this organization for this year is putting together a comprehensive cardiac care program. And we're doing this in conjunction with the American Heart Association. And so you will see, hopefully within the next few months, branded materials that have the Avow logo, the MPHI logo, and the American Heart logo on them that are all designed for one purpose, and that's to help any patients who have cardiac issues really get pain and symptom relief from their disease process sooner than later, and then get them connected with a quality palliative care provider and or hospice provider when the time comes. So we're excited about that. And also our foundation team is continuing on just with the exceptional job they've done by virtue of all our wonderful donors and the support that our donors give, much like all of you on this meeting today. But our focus in the future will continue to be on plan giving. We also are engaging all of our different patient family members through the Grateful Families program. And exciting, we're developing a palliative care giving society. And so I know Annalise is excited about that, and we'll share more details as those come. And finally, as I mentioned earlier, we're continuing to create endowments to support many of our different programs that are either underfunded or unfunded, like our Avow Kids program. So that's exciting. And we have a lot of different irons in the fire in terms of making sure that the care that Avow is known for today continues on into the future. And finally, our strategic direction. This is of great importance, I think, to all of you and to Avow in general. In looking at where the healthcare continuum in this country is going, it's kind of really getting away from the segmented, siloed care that we've seen for the past 40 or 50 years. And now we're starting to see models that are focused on continuum of care and services. And so as Avow does an exceptional job with our interdisciplinary group and all the logistics surrounding everything we have to do for our families, we're going to focus on expanding our continuum of care so that if and when we get to a point where everything is based on continuum of care and value-based purchasing, we'll be ready for that with the services that are home-based, that are being demanded by patients and families, and really at some point in the future will be dictated by insurance companies that are really taking over in terms of being the main payer for many healthcare organizations. And again, I think the last bullet point there says it. We really want to be the first choice in Collier County for anything related to home-centered interdisciplinary care. That is our main goal. And so, again, as I've said throughout this presentation, everything that we do at Avow would not be possible without the support of all of you on the call. And certainly, we just can't say enough and thank you for all of your support throughout the years. And making certain that what Avow stands for continues on forever. So on behalf of myself, our board, all of our staff, I can't thank you enough for supporting our mission. But with that, Annalise, I hope I didn't go too far over. I just want to thank everybody for being here and certainly would welcome any questions.
Jaysen, you did a fantastic job as always. I actually intended and neglected to do so, but I wanted to acknowledge that Jaysen completed his 5th anniversary with Avow last October. He had a doozy of a 5th year, that's for sure. I'm sure you'll agree, but Jaysen has done a remarkable job leading us over the last 5 years. For any of you who have not yet met Jaysen, we are now hosting visits back to campus. We are not hosting large groups, but we are doing small visits on an individual basis. So if any of you are interested in coming to take a peek at campus to see how things look and hear additional updates, or if you have program specific questions or interests, I'd be happy, or any of our team members would be happy to facilitate a visit with Jaysen. We all do great campus tours, but Jaysen does the best of all. He's extremely thorough, and I'm sure you'll also agree that he has a remarkable level of enthusiasm to share. So thanks, Jaysen. We appreciate that. So I have not received any questions in the Q&A box. Lots of very positive feedback, Jaysen. Folks have really appreciated the information you've shared today. And I have a couple of closing comments that I'd like to share as well. But I did actually have a question, something I neglected to notice when we were preparing for today, and that is related to complementary therapies. Comp Therapies is one of the integral programs that we work very hard to secure funding for through the foundation. Can you give just a real quick update on how complementary therapies was or wasn't affected by the pandemic and what we're looking at there going forward?
Oh, sure, and Annalise, thanks for that. Yeah, so just a reminder to everybody, our complementary therapies team is comprised of and they're all board certified or licensed and credentialed. We have music therapists that are full-time employees at Avow. We also have massage therapists that are full-time employees at Avow. And the more recent addition is we have an art therapist, again, who's a full-time employee of Avow. And I'm sorry to repeat that they're full-time employees, but oftentimes I think the community or even our patients and families think they're volunteers, but they're not. They're board licensed, credentialed staff. And again, as Annalise said, they are an integral part of the interdisciplinary team. And we only have them here through the generosity of donations and the fact that our board supports having that type of care when it's unique, and many other hospice organizations cannot afford to do that. And so the Comp Therapies program, their main goal, again, is outside of kind of the normal scope of using medications or things, but they do all different sorts of modalities to reduce all the pain and symptoms related to the disease process through the different types of, again, as I said, I guess you could call it therapy that they do, respectively, through those 3 different disciplines, whether it's music, massage, or art therapy. And they are extremely successful. And so probably there are 2 comments that I get oftentimes from patients and families is, number one, they wish they would have known what hospice and palliative care really was sooner than later, so they could have got involved sooner. And the second thing is, can I have the music therapist come and the massage therapist on a weekly basis? And so it is a very expensive, unreimbursed program for us. And although we would love to do that at some point in time, it is difficult and challenging. And I would say for all of our comp therapists, that is a request they get as well. Can you come back tomorrow? And unfortunately, they can't. But during the pandemic, they pivoted very quickly. And so our music therapists were doing a lot of things online, and our massage therapists transitioned over when we were still kind of in a massive lockdown to help out in other areas of the organization, as did our art therapists. But as the year progressed and we started getting back to kind of normal, some sense of normalcy within the scope of the pandemic, they resumed their duties exceptionally and continued to provide those three unique services to all of our patients and their families, and have continued on to this day. So again, Annalise, thanks for reminding me. It's an excellent, excellent program. And that is one of the ones that we are striving to get an endowment for over the coming years, so that that program will stay in place no matter what happens to reimbursement in hospice or palliative care in the future, so that our patients and families will benefit.
Thanks, Jaysen. I appreciate that. We do have a question, and you did a great job covering all of the expenses we already incurred in 2020 related to COVID. Do you have any projections for what COVID expenses specifically are going to be for this year?
Well, that's a good, I actually have a stack of financials here on my desk, so I could thumb through it, Annalise, but I won't bore everybody with doing that. I could give you the exact number, but I think, as I said in the presentation, I expect that probably our COVID expenses for 2021 will probably be a little bit less than 50% of what they were in 2020. And so our overall expenses, I think, for COVID, just going off the top of my head without pulling the financials, were around 1.2 million, I think, for 2020 all in. So we'll probably be at less than 50% than that this year. You know, right before our meeting this morning, Governor DeSantis in Florida announced that there's an expansion of the vaccine. And the next group that will be able to be vaccinated is people over the age of 40. And then the next group after that will be people over the age of 18. So I think, combined with what President Biden said a couple of weeks back and what his goals are for there being enough vaccine for every American over the age of 18 by the end of May, now it seems like Florida is recognizing that and sees the influx of the three vaccines that have been approved by the FDA. And so, having said that, it looks like we're going in the right direction. And I think once we achieve that so-called herd immunity that we all hear Dr. Fauci talk about frequently and often on TV, that will help us with our overall COVID response and expenses. And so, again, to make a long story short, I would expect that we'll probably be at less than 50% of what our expenses were for last year.
Fair enough. Thank you. All right. Well, we are coming up at the end of our time here. I want to be mindful of that. And I do have a couple of announcements to share, as I mentioned before. Thank you for being with us, Jaysen. We appreciate it very much.
Thank you, Annalise. And again, thanks to your team, everything you do. And thank you to everybody on the call.
It's our pleasure. So I'm hoping that you have all received a copy of the Luminaries magazine in your mailbox, or picked it up at a location near you. Luminaries published in the first part of March. It is our magazine that we put out just twice a year, and it's full of fantastic human interest stories that share information about how our programs and services are impacting the community with your help. So if you haven't received a copy of Luminaries, please let someone on our team know, and we would be happy to mail you one or deliver it in person. Jaysen also mentioned that our music and art therapists got involved in some alternative or other projects when they weren't able to make patient visits directly last year. And so I wanted to make sure that you all are aware that we have a wonderful YouTube channel at Avow TV. You can access all of our videos through avow.tv in your internet browser. And there you'll find all sorts of self-help and self-care videos, some lovely music videos, a couple of holiday themed things that were recorded, and also a lot of our veterans activities were recorded in this past year on Zoom as well, and they're there for you to view at your leisure. So please check out avow.tv at your convenience. We also have a couple of really important events coming up next week. Our Veterans Services Committee is hosting a Vietnam War Veterans Day event on Monday. It is on Zoom, and if you're interested in that, you can call our office and we'll share some details. It's Monday morning, March the 29th at 10 a.m. And then a week from this coming Saturday, on Saturday, April 3rd, we will be having our annual butterfly release in Cambiar Park. Last year, unfortunately, the butterfly release was completely canceled, and we did not have time to get a virtual event in place to do that. We just weren't ready. And so this year we have planned, we are going back to Cambiar Park live, and we are also doing a live stream so that those who are not yet comfortable with coming out to a big group or a social engagement can watch from the privacy of their own home. We are still accepting donations for reading of names at that ceremony on April 3rd. And if you're interested in that, you can certainly find more information out on our website or by calling the office. In May, we will celebrate Nurses Week with our second annual peer-to-peer online campaign. Nurses Week is May 6th through 12th. If you are interested in being a peer fundraiser, we are recruiting now. This is a great opportunity for you to learn new skills and also for you to share your network of friends and family with Avow so that you might help us to generate additional funds to support our programs through the people that you know. I promise it's painless and pretty easy, and we're going to give you all of the coaching and tools that you would need to be successful. So if you're interested in that, you can contact our office and look for future emails as well. Last but not least, our treasure stores are open. Jaysen shared a lot of sort of scary statistics about treasures earlier and all of the losses that we had last year, but we are quickly making those up here in 2021. Our stores are open now Monday through Friday, 10 a.m. to 4 p.m., and we are accepting donations. So if you are getting ready to do any spring cleaning in April or May, please keep treasures in mind. If you have any gently used items that could be donated, we would be happy for you to drop them off at our stores. Or if you have bigger items that need to be transported via a truck, you can contact our office to schedule a pickup, and we'd be happy to receive those items from you. Those are all of the announcements I have left today. We were thrilled to have you with us this morning. Thank you for making the time. Thank you for supporting Avow and all of the wonderful work that we do in the community. We simply couldn't do it without you, and we appreciate you very much. Have a wonderful day.